cloud.
The cloud?
Yeah,
Okay.
I think that'll work. Oh, I'm recording on my, okay. Sorry, I'm trying to get situated, but I'm Alexandra Roark. I'm a therapist here working with Dr. Ron at the Houston Neuroscience Brain Center. I do neurofeedback and talk therapy with children, adolescents, and young adults. And just if everyone could make sure that they're muted throughout the session. Are you going to take questions in the middle or just wait till the end?
Well, let's wait till the end. It's
Okay.
not that very long of a program, but if they got questions, put in the chat.
Yeah, you can put.
They won't lose it.
Yeah. If you have a question, put in the chat. We save a lot of time at the end for discussion and questions. And then just make sure you're muted. And then if you could put your email in the chat, we will make sure you get a recording of this either this evening or tomorrow. And so, Brooke, do you want to talk about Fusion now? This is our sponsoring with Fusion Academy, ADA SR, and Hub Houston.
Yeah, absolutely. Well, hi, my name is Brooke Brossman. I'm the Director of Outreach for the Sugarland and Houston Galleria Fusion Academy. We serve 6th through 12th grade. We're fully accredited private school, and we are one-to-one personalized education. So every class will be that one teacher to one student model. We offer full-time credit recovery and tutoring and mentoring. So if you feel like you have a family member or anybody you know, just send them my way and I can help them see if Fusion is the right fit. But yeah, I'm super excited to have everyone on this call today and looking forward to learning so much from Dr. Ron. So thank you.
Yes, thank you.
Pam,
I guess you can go next.
Okay, hi, I'm Pam Esser. I'm Executive Director of the Attention Deficit Disorders Association Southern Region. We go by ADA SR for obvious reasons. We're really excited to be involved in this collaborative. I think this is our 3rd year, if I'm correct. And I have learned tons of things. It's great for networking, and please check us out. We have 6 free presentations per month, including this one with Dr. Ron's group. Additionally, we have workshops. We have one coming up in August on addiction and ADHD. So I'll put our website in the Zoom, but please check us out and use us as a resource. Thank you.
Awesome. So Dr. Ron, you can give a little spiel about
Sure.
the Brain Center.
I'm Dr. Ron Swatzyna. We've opened up the Brain Center here in 2019 in December, right before the pandemic. And I don't know, I think the pandemic kind of helped us get started, but if something as terrible as that can help you, I guess we're going to go with that. We are a neuroscience brain center. The reason I wanted to call it that is because we do research, we do clinical research out of here. We publish and present our findings all over the country, and I've done it internationally for quite a few years. We look at all sorts of ways to intervene, and next month we're going to do a presentation on how did I title it?
Let me see.
But next month is going to be an interesting, it's to medicate or not to medicate, a neuroscience perspective.
And that'll be on September 17th or 14th at 12 p.m.
And so that it's going to be quite an interesting, there's a lot of science that came out, a lot of studies that have come out in the last year about medications. And I just want to make everybody aware of those. We'll get into how medications work, what they do, how they can help, and then how they can hurt. So we'll talk about it all. We do want to keep everything always from a very scientific perspective. Everything we do is always referenced according to the studies, and we'd like to keep it that way just because people have to know the facts. And I think once they know the facts, it makes a big difference. So we do a lot of different interventions here, from neurofeedback and biofeedback, as Miss Alexandra said. And then we also do photobiomodulation. We do pulse electromagnetic field therapy. And we do, we're getting ready this fall to actually start a hyperbaric oxygen program here. And this is getting a lot of good results with our autistic children population. The chamber that I talked with the manufacturer this weekend about is going to be big enough so that it's not a chamber you lay down in, it's a soft chamber, but you actually can sit in it. And so mothers can sit with their children in the hyperbaric oxygen. So I think that's a big advantage for trying to work with children that have a little bit of anxiety about everything. So, all right, we'll go ahead and get started then. Are we good?
Yeah, we're all good.
All right, I'm going to share my screen with you over here. Alexandra's camera is much better than mine, so we're using two at the same time. And let me get this up. There you go. Okay, and I titled this COVID, Neuroinflammation and Brain Fog. And like I say, COVID has inspired a lot of things to happen over the years. COVID has really been, you want to take that? COVID has really been inspirational for us in order to kind of identify some abnormalities that are linked to psychiatric issues. Oh, thank you.
You're welcome.
And so this is something that we've been looking at for a lot of years in regard to patterns that we see. And so we're going to get into the science, and there's not too many slides here. I gave this presentation on a panel in Florida in last month at the International what's ISNR, International Society for Neuronal Research. And so this is a combination of that. So the CDC, the interesting thing about it, and I've been watching it because brain fog, when they first came out, they said it was only 3% of the population. Within the next few months, it went to 6%. Within the next few months, it went to 30%. And then right now it's at 80% of those people who get COVID will eventually develop some sort of brain fog. And that doesn't seem to go away that easy. So we're going to talk about neuroinflammation and its progression through time and how that works. We're going to talk about a neurobiomarker that I believe we've identified in regard to being able to at least understand the intensity and when it's lifting, some sort of evidence-based. And we're going to talk about a hypothesis we've had in the treatment. So during inflammatory states, there's a lot of things that go on, and it happens at the mitochondrial level, the microglia level, and the activation can trigger two things to happen in the brain. Yeah, I'm waiting. It causes a hyperexcitability, and it causes overall slowing of the brain. Now, when we say slowing of the brain, the most dominant frequency when you hit about 13, 14 years old is supposed to be your low beta frequency, which is about 12 to 15 cycles a second. The slower your brain is, the slower the processing speed. Our average population that we see here is normally between 9.5 cycles per second and 10.5 cycles per second. They call them hertz. But when they talk about slowing, they're talking about taking this brain down to into the alpha, which is 8 to 12, and then into the theta, which is 4 to 8, and then into the delta, which is 1 to 4. And as you progressively get sicker and sicker, this is where it slows down. But you have this hyperexcitability that comes up as a beta wave riding on whatever the slow wave is. And so this overactive part of the brain that produces cytokines right off the mitochondria, resulting in a reactive oxygen species, which causes all sorts of anxiety and depression and everything else. Reactive oxygen species are the troublesome part of what's produced when we have this neuroinflammatory response. It produces this specific EEG pattern that we were just discussing, and I'll go on and show you a little more. Now, the EEG is what we do here. We do electroencephalograms, neurology standards. We minimum of 20 minutes between eyes open and eyes closed. 20 to 40 minutes is standard for an EEG in neurology world. We have all of our EEGs read by two different neurologists. One looks at the actual EEG signal, and one looks at the quantitative EEG brain mappings that are made. And I think this is important that we have neurologists look at this, because I'm not a medical doctor. I'm a Ph.D., not an M.D., and I can't call a lot of the things that they can call. I can recognize them, but I try to stay in my lane and let the medical doctors take care of that. And they do produce two great reports for us. So The EEG is actually a very good time-sensitive measure of oxygen perfusion, oxygen blood flow in the brain. And that's so critical to what we're talking about here, because last year in July, I got a carpal tunnel surgery done. Well, my wrist is still swollen up. It's still sore. It's still got inflammation in it. Now this thing is completely healed. Why is it not returning to where it should be? I mean, we have a chronic nature with inflammation in our bodies, with arthritis, with everything else that causes all these the terrible pain that we have out there. Chronic pain is a process of neuroinflammation. What do they give you for it? Aleve. What is that? It's an anti-inflammatory. There's so many things that they're looking to try to get the inflammation down, but rheumatology is struggling with this issue right now with inflammation. Now, inflammation in the brain, when we talk about the inflammation, if it's inflamed, it reduces the blood flow. So constricted blood flow produces this specific sinusoidal activity. Sinusoidal just means up and down, kind of like that test pattern used to be on the screen. Well, most of you guys weren't alive when we had test patterns at night when the TV went off, but that's what it looks like. And we'll show you a picture of that in a minute. So the sinusoidal activity is reflective of the oscillatory connections between the cortex, which is the gray matter on top, and the subcortex, which is the white matter underneath. And so when these are working properly, the sinusoidal type activity goes away. But when they're not, they're kind of fused together is when we have in our resting states or in a meditative state. You hear people go in and will start to meditate and they'll get into this deep alpha state. Alpha is a very sinusoidal rhythm, and it talks about that, and that's what's supposed to be going on during meditation, but not when you're actively working. So we've got this pattern we've identified as excessive beta, but it's got this spindling nature to it. And it might reflect poor perfusion due to neuroinflammation, constricted blood flow to the inhibiting normal activation of the cortex. So back up just a little bit. When 2012, I noticed that the same 4 issues were happening over and over when we had medication failure. Well, this was one of the failure modes. And it doesn't like a lot of the medicine that you would normally use to treat. These are the people that may have panic attacks, highly correlated with spindling excessive beta. They may easily be triggered by small things. So if you wonder, if somebody gets very upset, emotionally discontrolled over a very small thing, you go, I wonder why that was so upsetting to them. They may have a neuroinflammation. They may have the spindling excessive beta. So I think this is something that we got to look at. How is it all connected? So this is the prevalence that I just did in a study of 1,233 patients ages 4 to 50 to 72. We had 458 children, 314 adolescents, and 461 adults. As you can see here in the blue, I highlighted that in children, it's in 22% of the population. These are people, children, adolescents, and adults that have all failed multiple attempts at medication. So be advised that what we refer to in psychiatry as refractory, these are refractory patients. And so 22% of them that failed medications have the spindling excessive beta. In the adolescents, it's down to 20.1%. And there may be a reason for the dip, and we think it has to do with the surge of hormones, which surges during the adolescent years. But then in adults, we have 31.5%. Now, if we think about it, what can cause neuroinflammation? Extremes of heat, cold, or pain, psychological trauma, physical trauma, brain infection, and meningitis, encephalitis, and we'll talk about those in a minute. COVID, bacterial infections, viral infections, toxins, mold. We've got a lot of mold here in Houston creating this pattern. And we also look at brain injury. Definitely can cause it. I had one of my young people got hit in the head, a little 6-year-old boy, by a blunt force to his left frontal region. And the neuroinflammation was all over that part of the brain. And it's kind of like, okay, I'm sure it spread, but that's where it was started when we first did it after he actually had his accident. So You would think that as adults, we would actually obviously be exposed to more things than children and adolescents. So that's why I would expect that the adult population would have higher percentages. Encephalitis is the extreme, or meningitis encephalitis are infections of the brain. And infections of the brain, this is the ones that will end up killing you. You don't want to get meningitis or encephalitis and have it missed, because you can die from this brain infection. Well, in the research that my wonderful research assistants came up with this past May, I think it was, when I told them to start digging in to see if they could find anything in any other sort of research that might link this together. And they came up with this pattern, EEG pattern, called extreme delta brush. And it's characterized by a delta activity, which is the 1 to 3 hertz, but it's a slow delta wave superimposed with a burst of rhythmic 12 to 30 hertz activity beta on it. So it looks like a toothbrush with a wave to it. It's really kind of interesting to look at. And this is the actual reference to this next slide here. This is what it looks like. And you can see the spindles, obviously. And that's in the beta range. And these are quite probably about a 22, somewhere in there, 18 to 22 cycles per second. And when I saw this picture, I said, my gosh, that's beta spindles. That's what we've been looking at for years. But as you can see, it's on a very slow wave. This is not, some of this, the wavy stuff that we see. Can I put your cursor right here? This is using that cursor. Okay. You can see that this wave in here, that's about a 1 hertz. This is about a 2 hertz wave. So it's riding on a delta wave. And that's what they say, extreme delta brush. And so I thought, that is exactly what we've been seeing. But I think what happens is when a person first gets an infection, gets COVID or something like this, it starts out as very mild, very small amplitude beta spindles, and then it grows bigger and it expands from not just the frontal lobes to the entire brain. So spindling excessive beta and neuroinflammation treatment. We have come up over the years doing this work, and like I say, I started this study back, first study was back in 2012, I think is when it started. It published in 2015. That's about the same time that the alpha-2 agonist Intuitive came out, treatment for ADHD in children. And they wondered why Intuitive works. And doctors would ask, how can a doctor at one of the presentations I was at, this old guy from an Eastern Bloc country said, I have one question after the medical person, doctor finished giving his lecture. And he said, how do I get from a blood pressure medication indication in an adult to an ADHD medication for a child? He said, it doesn't make any sense to me. And so the guy started spitting out chemistry and everything else. He said, no, you don't understand my question. If I'm going to explain this to a parent, how do I justify putting a blood pressure medication on a child and expect it to help with ADHD? And so Tiffany, the drug rep, was kind of taken aback, and she said, well, get with our medical director and I'll see if we can come up with an answer. And I raised my hand, and I'm usually the only PhD there because I'm the only one who work with medications. And I said, I might have a thought on that, Tiffany. If we consider that we've been told for years that ADHD is a problem with poor perfusion to the frontal lobes, poor blood flow to the frontal lobes, that if we put a blood pressure medication, and we understand Boyle's law, that as you increase perfusion, you increase volume, you lower pressure. So obviously the inverse is true. If you lower pressure, you increase volume, perfusion, that if you put a blood pressure medication, it causes vasodilation, you would likely get some help with this. And we did find that actually Intuitive did make this neuroinflammation, it lessens it. So clonidine and guanfacine are the two meds that we have found had some sort of positive response to this. The next thing is photobiomodulation. Well, photobiomodulation works because it works right on the mitochondria, releasing nitrous oxide, and then nitrous oxide intervenes and starts reducing the reactive oxygen species. That makes total logical sense. It also increases microcapillary blood flow, more oxygen. Hyperbaric oxygen, same thing. It increases the partial pressure of oxygen by putting it under 1.3 atmospheres in the case of most treatment now. And I was just talking to a biochemist, and 20 years ago, our oxygen content in our regular environment was at 21%. It's down to 19%. We've lost 10% of our oxygen over the last 20 years in our environment. And according to Darwin, it takes 14 generations for a brain to adapt. So there is maybe a reason we're having all this more of an influx, because now we have less oxygen available to us, less partial pressure of oxygen. So hyperbaric oxygen increases the partial pressure and puts you into a higher enriched field of oxygen. And it also encourages microcapillary blood flow, and it reduces neuroinflammation. Pulse electromagnetic field treatment is the same thing. It uses a magnetic pulse at a certain frequency in order to increase microcapillary blood flow. MD Anderson now is using this before they do chemo on individuals so that they can decrease the amount of chemo they need, because they've got more going to where it needs to be going to. And lastly, neurofeedback we see reduces this also, because neurofeedback has always been considered a very great way to create neutral positive perfusion. You put a little bit more taxing on the brain cells than they and need for oxygen, and it increases the microcapillary blood flow to the area you're specifically working. That's why it works so well with head injury and everything else. So it seems like everything is connected here. Spindling excessive beta, I think, is neuroinflammation marker. And if we right now, we only have blood tests that can tell you some of the possible indicators of neuroinflammation, but they're very iffy. The choice method, that not for patients, but for doctors, is a spinal tap. But I don't know how many of you guys went to a spinal tap, but it's not something I'd want to do every day. And still, that's not 100%. That's about 85% effective to identify neuroinflammation. And then, so I think we're looking at this as could be an EEG biomarker. An EEG is much easier and a lot less invasive, a lot cheaper, and it can give, if this is truly reflective of what I think it is, then we have a way to treat it. And so it's something I think that I wanted to bring up to everybody, and I'd love to hear your questions about it. I do have my references in this, and I can pass this on. Do we have any questions?
Let me check. I'm going to check there is a sweet comment from Susanna saying Pam Esser is a wonderful and very knowledgeable resource. I appreciate all the work she does. Oh, thanks for that.
That's good. Okay, I'm opening up. You can unmute yourself and just chime in, and I'll be glad to answer any questions on this. Like I say, this is a new concept. It's never been presented except for once at the conference last month. But I think we've got something we can. So I'd like to hear about the people who may have experienced brain fog and what symptoms they had connected with that. This latest COVID surge that we've had, which I did get too, it's causing a lot of continuing problems over time.
And then while y'all are thinking of questions or comments, I'm going to be putting his information into the chat. I believe Pam and Brooke put their information in the chat as well. Do you want me to put your brain center on?
Sure.
I would be interested in the research on medical grade HBOT versus the blow up tubes, and if they're having similar results.
Okay, I just published this article on treating severe brain injury with hyperbaric oxygen combined with neurofeedback. Dr. Harsh in Louisiana set up all the protocols for the hyperbaric oxygen. The people had their own home chamber. And in hyperbaric oxygen treatment for brain injury, 1.3 atmospheres is all we need. If you're going to go to 1.5 atmospheres, that's more for, and over, that's more for treating necrosis or any sort of wound care. That do need a higher partial pressure of oxygen, but for brain injury, 1.3 is where the standard is right now, and that can be done with the soft chamber.
Okay, thank
right.
you.
Sure, good question.
I would like a clarification on the very last sentence on the last slide. It was about the early EEG biomarker for NI. What is NI?
Neuroinflammation.
Oh, thank you. So that makes sense. And then it was reflective, and I didn't get the last couple of words.
Okay, well, let me bring it back up. I'll share my screen again with you.
Thank you so much.
Sure.
Thank you.
Like your brain infection. Okay, it can be brain infection, it can be brain injury, it can be psychological trauma, anything that upsets the homeostasis of the brain. Basically, if once the brain is the EEG homeostatic regulatory system, and so your brain is supposed to be able to come back into regulation using neurochemistry, and again, back to proper diet and everything else, of course. But what's keeping it from coming back to homeostasis? Well, this neuroinflammation doesn't seem to go away unless we do something about it. And there's hypotheses out there right now about why we have such a problem with neuroinflammation. I think that if we look at our human species, we were outside creatures until about the last 150 years, maybe 200 years, but for most of it, maybe 150 years. And it takes 14 generations in order for us to adjust ourselves to a new environment. And so we haven't been through 14 generations in the past 150 years. So this is why we're having difficulties with it.
Yeah, and then if you look at diet, I've been reading articles that are saying that the seed oils like sunflower oil, canola oil can cause neuroinflammation as well.
So there's a lot out there on neuroinflammation, and there's not many answers, but it's nice that we've coming at it from a different perspective. It kind of makes some sense. We don't get exposed to the 810, the full spectrum light, because we're not out in the sun as much. And in that full spectrum, photobiomodulation is at 810 nanometers, which is the area that will destroy or reduce or intervene on neuroinflammation or any inflammation. That's why when they had tuberculosis wards and stuff like this that had any sort of outside exposure to sunlight, they did much better. The leprosy colonies overseas on the islands, the same thing. If they were able to get outside and enjoy the sun, they had a far better resolution of their symptoms compared to those that were just locked inside. So being inside may be a big disadvantage. So I've been trying my best to get out at least on the weekends. And I do have a full spectrum sun lamp in my office to wake me up in the morning, because I get here at 6 o'clock to see my first patient at 6:30. So it's early times for me.
I have a question. How long do we need to really be outside and exposed to the sun for it to help us?
I don't know. That's a good question. I think we have to balance the potential for melanoma. You don't want to become a sun worshiper and have the old leathery skin and have a lot of skin cancers removed. But on the other hand, I don't have the answer for that. I expect that the more we can get out there, the better we'll feel. But, I've been trying to make a concerted effort on the weekend, and my arthritis and inflammation in my body, I don't feel much change in it, but I do enjoy being out in the sun. So I wish we knew that.
Well, it does, just a few minutes, if you have bright sun, will have an effect on slow brain waves, waking it up. So that doesn't take long at all.
It does suppress melatonin. That's why you should go out into the sun in the morning, because it will suppress your melatonin and help with sleep issues. Because then at nighttime, when the red hues hit as sun goes down, then the melatonin surges back up and kind of helps with your circadian rhythm. So we have that. The person wrote a message here, naltrexone to treat COVID-induced neuroinflammation. I haven't heard of that.
Ooh.
Anybody?
I've been on LDN since I had COVID, and it's helped tremendously.
Can you give more information? I'm curious.
So I don't know who asked the question, but yes, I've been seeing my doctor regularly. I had pretty severe long haul COVID with POTS and pneumonia and the whole 9 yards, all the brain stuff. So I've done multiple different therapies and have recovered quite well. Recovered my brain. I'm an EEG person, so I have my pre-COVID, right after COVID, and now I have my recovery EEG. And that's one thing I was going to ask you, Dr. Swatzyna, about, you know, the high beta writing on alpha, which I see a lot. But to answer the low dose naltrexone, you know, it is a low dose. You know, it's not like it's in that family of, you know, that helps you with addiction. I don't.
Right.
It's in that family of drug, but it's at such a low dose. But it is helpful with arthritis. It's helpful with all kinds of inflammation, including neuroinflammation. And, you know, and I'm going to do a presentation to a study group, and I'm going to show them my neuroinflammation markers went down. My whole body inflammation markers went down. And I'm sure it was a combination of therapies, but I have been on LDN since January.
And so that's something that you just have to go get from your doctor.
You can get it from your doctor, but you can also get it from an online doctor, which is what I did.
Okay.
Before my functional doctor knew about it. Now she knows about it, and she's prescribing it because it was so successful with me.
Wow.
So naltrexone antagonizes various opioid receptors. That's a mechanism of action of the naltrexone. I'm just trying to see what logically would that create a vasodilation?
Josh said again that the therapy is mentioned by the FLCC.
Okay, what's this LDN 2 therapies mentioned by the FLCC protocols? Okay. Just somebody had a comment about that. It's some of the therapies mentioned. I'd sure like to know. I'll present that to a biochemist I'm working with and try to, because I always got to understand why something works.
Sure.
You know, I'm glad it works. I'm glad to have that information. I'll be talking to him this afternoon again, but we had a big, long discussion about neuroinflammation and body inflammation today and cancer and everything else. But some of the other research that we're pending getting into right now. But that's great information. Appreciate you sharing. What else? What is HBOT? Hyperbaric oxygen is what HBOT is.
We forgot Katie's.
Okay. And it's where you go into a soft chamber or a hard chamber and increase the oxygen through an oxygen concentrator in the soft chambers, and increase the atmosphere to 1.3 atmospheres, increases the push into the cells. Again, working on the increasing the microcapillary blood flow and getting more oxygen in to where it's needed. Oxygen is a healer. Who do we miss? Treatment efficacies for different types of treatment. Also duration of treatment for each outcome expectations. You know, that's what we're working on, Katie. We're trying to get enough data together, and I would really like, Terry, if you could send me your EEGs. I'd love to see the pre, the during, and the post. I'd love to see those. My email's in the bottom. And just if you got them in .edf format, that'd be great. I'd love to take a look at them, because that's what we're doing with Dr. David Cantor is doing a nationwide study about this. And we liked when we got pre and post EEGs and on this kind of stuff, because it validates what we're saying, especially since you've tried the naltrexone.
Yeah.
Okay, other questions here? So has anyone tried heart breathing or heart math to improve respiration? There's a lot of good research out there on heart rate variability biofeedback training for decreasing anxiety and increasing the relaxation response, which a relaxation response would increase vasodilation, which would bring more in. The more stressed you are, the more tight all your vessels are, and the less blood flow. The more relaxed you are, the more oxygen. That makes total logical sense that it would help as well. But it's hard to go out through your entire day doing your relaxation breathing all during the day. But we still recommended, you know, two times a day would be, for everybody, would make them feel a lot better. Other questions? Corey, you're here. Chime in.
Yeah, well, so I'm curious about the Delta brush. Could you just talk a little bit more about like how you recognize that, and then also if you're seeing it more, is it more diffuse or is it more localized?
Well, no, when it gets to the delta brush, it's a whole brain infection. So it's all over the brain. The whole brain has slowed down diffusely, meaning the whole brain, slowed down diffusely into a predominant delta signal, 1 to 4 cycles per second, 1 to 3 cycles per second, whatever. And on the end of it, you'll see these little beta spindles that are on one piece of it, because beta spindles wax and wane. They come in, they go out. And so what it made them think of a toothbrush or a hairbrush with the bristles on the end of it, is why they call it an extreme delta brush. It's just the morphology of it. But my hypothesis is that when we see spindling excessive beta, basically the beta brush part on riding on an alpha wave or riding on a predominant a beta wave or whatever, it's a distinct pattern. It can't be picked up on a QEEG. It'll just show excessive beta, but the morphology is what makes it spindling excessive beta. And it was first written on in 1950 by Gibbs and Gibbs. And then the second article was 2015, the third by Martine Arns and myself. And the third article was 2021, and I was on the second and the third article. So it's something rarely researched. We're just getting the information out there. Nobody's made this connection until I saw the extreme delta brush. I said, wait a minute, that's the beta spindles just riding on a delta wave. That's, that's probably right before death, because if you got a predominant delta signal, nothing is going on in that brain, and that's the brain right before death. So it's that's what fascinated me when my team came up and said, well, look at this. This looks like what we've been seeing. And sure enough, it was.
So it looks like Christy had her hand up.
Okay.
If Christy, if you have a question or comment.
This is
I think you're muted though. If you'll have to unmute if you have a question.
Christy Yerby.
Yes,
Yeah.
I'm sorry. Okay. I put it down because I'm like, I have just like so many questions. I don't even like know where to go or what the most important thing to ask is. But I'm a parent of a daughter. She was diagnosed with POTS back in like 2017. And I've tried everything. She's not even in school right now. I can't get her up in the daytime. She's tired all the time. And I know you're talking about vasodilators for like getting more blood flow, but is that like opposite with kids like my daughter who?
Yes. In answer to your question, postural orthostatic tachycardic syndrome, POTS, otherwise known as dysautonomia, is one of the most complicated, complex, backwards thinking diagnosis we have. I've got a cardiologist here in Houston, Dr. Asif Ali, that has actual machine to measure it, not just a tilt table. I like it much better. But what this is a problem with, it's a problem with the baroreflex sensors in your jugular veins. When you stand up, they're supposed to constrict to keep blood in your head. The main problem is it doesn't work like that in these people. So the treatment that we've been using for this, and find you a practitioner or you can come here, that does heart rate variability biofeedback training, highly good to reestablish those baroreflex in these kids.
Thinking about that, and I didn't know if it like had a really like a medical basis or if it was like hokey.
It really does work because it's resetting those baroreflex in the jugular vein. So, and you can do, especially on kids, they will come back. Now, the interesting thing about this is everything that you would think to treat her anxiety and everything else with don't work.
And the psychiatrist, she was put on everything. She was on so many psychiatric medications.
And
The other thing is she has a lot of irritability and up and down mood swings, which she feels like makes her bipolar. And I'm kind of wondering if that's actually just a physical reaction to her condition.
Well, again, to me, why did she get POTS? I'm always backing up. I'm backing up to that question before, let's don't just treat a symptom. Let's try to figure out what went awry, and that's why I'd love to see her do an EEG and see if she's got the spindling excessive beta, which they do often go hand in hand with each other, because it,
Okay.
again, is all around a blood flow issue. One of my patients, and thankfully Dr. Deborah Stokan, genius doctor, did just the opposite of what anybody would think would work. And she put her on a stimulant, and it helped. When you think, what do stimulants do? They vasoconstrict. They create more blood in the brain because they're going to hold the blood from draining out. Kind of a backwards way to do it, but it actually helped her. You know, and when you think about the symptoms, you think they need a stimulant. She won't get up. There's no energy left. There's nothing like that. But I think the reason it did is because it helped keep more blood in the brain. I don't think that's a long-term fix for it. I think it would be worth some sort of experimental what do you call it, empirical trial. But I think that in the long run, I really think that trying to do some really good hardcore biofeedback training and then look for what triggered her into this, because yeah, POTS is it's a disabling, a dysautonomia is disabling, and then you can't go forward with your life, and that's such a waste. But and they are very difficult cases.
Yeah, I will look and see. Are you in the Houston area or?
Yeah, I'm up here off of Kirby, just north of 59, one block, 2 blocks north of 59 on Kirby.
All right. Okay. Thank you so much.
Yeah, we've got my email there. You can email me too. Could you please
Okay.
show the EEG again that highlights the pattern you've been observing? Yeah. Share screen. Okay, why aren't you working? Okay, that's the pattern. Let me show this to him also. And this right here, these are some of my samples that I have been using for years. And I'll just hold those up in front of the screen. Oh, in front of your screen. Okay. You see that? You see the little, you can see the beta spindles in there. That's the dark lines. They wax and they wane. Yeah, I can see right there. So those are riding on a, kind of look like the same ones we were just looking at, but that's what they look like. They're very obvious. Now, these are the big F2s. Sometimes they're small F1s, but I think, again, measuring the intensity of the problem. Who else has had a question? Is that actually from Maine? Wow. Aubrey Flanagan from Maine. We got some people out there now. Any more questions, guys, that you run into and that's concerned you? It doesn't have to be about this. We've got this time set up for just general discussion. And Christy, are you there?
Yes, I'm still here.
Okay, Christy. Tell me about, she runs a practice in
I
Dallas,
think there's multiple.
the Vet
Christies.
Center. Christy Lewis?
No, that was Christy. We
Oh,
have multiple.
I am here.
okay, Christy. You're the other Christy.
The other Christy.
Yes. So what have you been seeing up there in Dallas?
What have I been seeing? Well, I have a clinic in the North Dallas area, and we do biofeedback training, mostly a heart rate variability training, and we do neurofeedback training as well. We also do neuromodulation therapy and photobiomodulation. The neuromodulation is it's a magnet, pulse electromagnetic stimulation, and alternating current and direct current stimulation as well. But we do all the other things that Dr. Ron was talking about. Lately, I have been seeing, this is why I was interested in this discussion, because we have been seeing some folks with spindling beta signature, more so lately. I don't know why, but it's just, I've been getting more and more of those types of clients. So it's been very interesting. And the medication effects. So recently I've been learning about how specifically this one client that I had actually talked to Dr. Ron about has spindling beta features. and is on SSRI, and it actually made his symptoms worse, OCD type symptoms. So he's tapering off, and guess what? His symptoms are improving. And we're also doing training with him, heart rate variability training plus neurofeedback.
And I think that's a great thing to understand that, you know, the studies out of Europe have found that when people have spindling excessive beta, their primary complaint is extreme anxiety and sleep issues, sleep maintenance.
Yes, he's been issues, especially.
The brain won't shut up at night. It just keeps chattering, and they just so they get more and more tired. And, you know, you've heard of those studies where people were put on SSRIs for the first time and they become bipolar. I think this is the pattern, because SSRIs by their nature increase beta. And so they would make it worse.
This young man in particular, it's been interesting. Literally felt like he kept saying, I feel like I have schizophrenia. And you know, or bipolar. He's trying to self-diagnose, and so now that he's getting off of the SSRI, you know, like I said, he's starting to normalize. But what I was going to say also, and I know this isn't something that you do at your clinic, but we have this pulse electromagnetic stimulation, these little magnets, and one of the protocols we use is inflammation reduction. And so we do use that protocol along with literally giving someone low beta or alpha, typically 12 to 15 cycles per second. So it would be the low beta, to help bring down the excessive beta, and combine it with the inflammation reduction protocol. And it does give the individual some immediate relief. And then we follow it up. So it creates this neuroplasticity, is change, and we follow it up with neurofeedback training. And it's been very helpful with a lot of our clients. I have another 12-year-old kid with excessive spindling beta, with migraine headaches, difficulty sleeping, just couldn't go to school, just a mess. And his spindling beta now is almost resolved. It's quite amazing.
Super. And I imagine the symptoms are resolving as well.
Yeah, he's doing much better. So not perfect, but definitely better. So sleep is better, no more headaches. So that's pretty exciting.
Well, you know, spindling excessive beta have been also associated with migraine auras. That's some of the basic work that Jay Gunkelman did years ago on it. And so and what are migraines? Migraines are a problem with ischemic process going on in the blood vessels that get into a rebounding effect. And so it's all makes total logical sense that it's linked to blood perfusion. So
it does. And in fact, this kid was so complicated because he had not only migraine headaches, but also what's it called? Abdominal migraines. And can you talk a little bit about abdominal migraines? We don't get those very often, but whenever I do,
sure.
It's always complicated.
My colleague 2 doors down, a psychiatrist, she came, she said, Dr. Ron, I got a case for you. She said, it's driving me crazy. I got a 17-year-old female, very intelligent, but her stomach is just tore up. They've done everything to her. They've done upper GIs, lower GIs, can't find a single thing around her. So they referred her to me to treat her anxiety and everything else. And I said, I think I know what that is. She said, you do? I said, yeah, I've had several cases, mostly females, mostly 18 to 20 some years old, could be younger. And I think it's abdominal seizures. And they call them migraines, but they're actually seizures, and they're occurring right around the central motor strip of the brain, right where the gut is basically. And they're triggering here, but they're happening, they're feeling the effect down to their gut. And it's a really interesting thing. And the fix is so easy. You get them on the right anticonvulsant, and you put them on a course of anticonvulsants for usually about 2 years to where it relieves the symptoms. You don't go to dosage you would normally go to stop a seizure, because it's not a convulsion. It's not a grand mal seizure. It's an abdominal seizure. So you can use much lower dosage. And then once you get it kindled out for a period of time, you can pull them anticonvulsant off, and it's fixed. It's the only thing that will actually fix something in psychiatric medication called a mood stabilizer. But that's what it is. They're really fascinating cases, but it's so terrible when they go through all this stuff. They can't stay in school. It's just the stomach issues are just through the roof. So if you guys come up with any of those cases, we know what to do with them. Just send them our way.
Yeah, same here. And Christy, it's good to meet you. I'm actually in Denver, but Jay has said that some of those smooth muscle convulsions come out of the insula. So we've trained a few people successfully with neurofeedback.
The insular cortex is a very interesting. If you see the activity at say T4 and C4, but at T4, but you don't see it at C4 and you see it at CZ, it's likely a deeper brain spike hitting the insular cortex, and it accounts for a lot of the psychosis and the delusional thinking in people, and they're not schizophrenic, and it won't and it will antipsychotics will make them worse. So it's something like that, and they get put on an antipsychotic because they've got some sort of psychosis or delusional thinking, makes them worse. 9 times out of 10, it's just an insular issue. And again, easily treated once you know it's there, either with neurofeedback or with medications or with both.
So for those who are using the neurofeedback, what type of neurofeedback are you using?
Well, I use primarily amplitude training, and I've done that for years because 99% of the research has been on amplitude training. There's a lot of different methods for doing neurofeedback out there. And I will say about 60%, 70% effective on no matter what they do. But there's not the research out there on it. I think that there's some hesitation for me to go into the automatic stuff like the Live Z score, the avatar training, or that kind of stuff, or the lens training. Number one, because there's not the research to back it yet. Number two is I just don't see the logic behind it, but it seems to work. So there's something going on with everybody that does neurofeedback, no matter the modality, they're getting some good results. I like to, but the lens system, for instance, Ottmer system, he's doing a lot of research on it, stuff like that, and hadn't got it really to publish yet, but he's working on it. But it's a low energy system, and it's just most of that low energy, that slow wave activity that they're trying to train is mostly movement. And so it's like, I don't understand how this works, because just your slight little movement, it can look like a delta wave, and it's not a delta wave. It's just artifact. It's just a movement. So I do say that I don't like doing symptoms-based neurofeedback. And Ottmer's based on symptoms. You don't have to do an EEG. If I want to do work on the brain, I want to find out where in the brain the abnormalities are. Does it have a correlating symptom in the real world? And when it does, then if I fix that part of the brain, then the symptom should be resolved, and it is. Medicine is right now based upon symptoms. You have XYZ symptoms, they're going to give you these medications, and then when those don't work, they'll go to off-label. Again, we know that symptoms-based treatment doesn't work most of the time for most of the people. So again, I'm with the neurofeedback. I'd rather look at the brain, see what's malfunctioning, tie it into some of their symptoms, and then go after that spot. Okay.
Hey, Carla, we do the same thing. We do an initial quantitative EEG to see where the dysregulation is. And then about 80% of our clients do the surface neurofeedback, just like with Dr. Ron. And then some of my clients do 19-channel Z-score training. But we do combine it with other modalities, like we've already discussed with the HRV training, and then some neuromodulation, some photobiomodulation. So we do a multimodal combination, but we always fit in the neurofeedback. Typically, we do the surface training though, and tailor it to their unique QEEG.
Correct.
One thing I want to mention, just because Christy Yerby's daughter is vagal stimulation. There are devices that you can buy, just on the internet that really help me with my POTS through vagal stim.
Can you send me some information on that?
Yeah, I definitely will.
I got another case that just came across my desk, and I'd sure like to put it into the chat maybe so people could look at it, because POTS is such a difficult thing to treat, and I would really like to have more options.
Well, and it really is
one more minute.
multimodal, as you have said. I was doing a lot of therapies, at the same time, but that's something that I added that made a pretty good difference for me within about 3 or 4 weeks.
Okay. Good.
Christy, can you put okay, you already did it. Christy, put the name of her center in the chat for anyone. Well, it is 1, so we are going to have to go. If you want the recording and you haven't put your email in the chat, please do. I'll stay on just for a few more minutes so people can give us their emails. And then if you have any other questions, his email is drron@hnbraincenter.com. It's in the chat. You can feel free to reach out and ask us any questions. And then you can join us next month, September 14th at 12 p.m. And the topic is going to be on to medicate or not medicate, the neuroscience perspective.
Correct. And we would love to see you all there. It's going to be quite an interesting. I'm going to bring all the current research up there for you. Okay, thanks, guys. Appreciate it. Thank you, Pam. Thank you, Brooke. All right, we'll see you guys later. Love to have all of you.
Yeah. Oh, I forgot to.
Stop it.
Brooke, oh, yeah, let me stop the recording.